Hello everyone, my name is Jordan. I'm the newest esthetician here at the Skin Specialist of Fayetteville. I'm here with Brittany, our acne specialist. We are here today to do a little Q&A on acne.
Yes, so we asked on our Instagram for you guys to send us your questions on acne, and that's what we will be answering. So, Jordan, what's our first question?
How does acne happen, Brittany?
So, acne happens because we get little microcomedones that occur when we have issues with our oil production or our shedding of skin cells. That causes little clogs in the pores, and then sometimes that can turn into an inflamed lesion. Usually, bacteria is the cause when we are dealing with inflammatory acne, but that could also have to do with just a general predisposition to inflammatory issues.
Comedones. Is there another term for those? Like, what do we usually refer to them as?
So comedones really are just what we would refer to as a clogged pore or a pimple. It is that little plug that is in the pore that is causing the issue.
Awesome. It's like a blackhead or a whitehead.
Yeah, absolutely.
Oh, for sure. Okay. So, what are the main causes of acne?
So if you think about acne, there's like the four main pillars, as I like to call them. So these things need to all be functioning properly in order to prevent acne from occurring. The pillars being oil or sebum production. Then we also have the inflammatory response, bacteria imbalance in the skin microbiome, as well as retention hyperkeratosis.
Can acne be hereditary?
Absolutely. So the genetic factor is actually the main reason that someone will become acne prone.
Interesting. Are there different types of acne?
Yes, so the main two types really are inflammatory and non-inflammatory. Inflammatory being those lesions that tend to be much more big and very red, sometimes tender and sore. You usually see more pus with those, whiteheads, as many people will call them. But the other kind, non-inflammatory, would be like your general blackheads or those little skin colored bumps that you know there's something in there, but they just aren't coming out. We've also got a couple of acne imposters that I like to make people aware of because some people will think that it is your traditional acne, but it actually requires a little bit of a different treatment. So that would be fungal acne, which is caused by a yeast, and generally those can look like little teeny tiny bumps. They usually present mainly on the forehead or the sides of the face, and there is nothing that'll come out of those if you try to extract them. And then we've also got acne rosacea. So that is just a type of rosacea that forms pustules on the face.
And they just require different treatment than your other types of acne.
Yes.
Awesome. How do I know if my acne is bacterial or hormonal?
So technically speaking, all acne is hormonal. There is generally some sort of imbalance in hormones. It doesn't necessarily have to be sex hormones that'll cause the acne to occur, but just hormones that influence the shed of skin cells or the hormones that influence the production of your sebum in your skin or your oil. But if your acne is inflamed, if it is like pustular with whiteheads and things of that sort, then it's pretty safe to say that there is bacteria involved there in that case.
Why doesn't my acne get better with skincare?
So if your acne isn't getting better with your skincare, that could be a couple of different reasons. Number one would be you're just using the wrong products. So there are a few different proven methods of clearing acne with ingredients like benzoyl peroxide, salicylic acid, even azelaic acid, and sulfur can also help some people as well. But I lost my train of thought. What was the question? You're probably not using the right products. So there's a couple of ingredients in your skincare that you'll find that are actually proven to treat acne, like salicylic acid, benzoyl peroxide, azelaic acid, even, and a few other things. But the other cause for that being the case could be that you aren't giving your skincare enough time. A lot of people think that their acne will clear up within a couple of weeks when they start a new skincare regimen, but that is just simply not the case for most people. It takes up to 3 months for acne to show up on the face after it has formed under the skin. So you could be dealing with old acne 3 months from the time that you started your skincare routine. The other thing is that you want to make sure that you're looking out for pore cloggers in your skincare. If you've got pore cloggers in your skincare, then you're just going to be stuck in a cycle of clearing those clogs that are caused by your skincare with your active ingredients.
Are there any key terms on a product that I might be using on my face that will let me know if it's going to clog my pores or not?
So a lot of people will look for the term called non-comedogenic, but the thing with that is that that actually was an old study done on rabbit ears, and that is not super accurate when it comes to judging our face skin. If you look online at Face Reality's website, which is the skincare company that I work with for my acne boot camp, they actually have a list of known pore cloggers, and because Face Reality has a 90% success rate, I trust that list to be pretty accurate.
Interesting. Very nice. What treatments can help acne?
Lots of treatments can help acne. Chemical peels are my favorite for treating acne, especially those deep peels like the VI peel with the medium depth, just because those are going to rapidly resurface the skin and get a lot of that gunk that's sitting underneath out. Of course, doing a series of those will get you your best results. There's also the Acne Bootcamp program that I do with Face Reality. They do that with a series of surface level peels and skincare products. So that might take a little bit longer, but you do tend to have a little bit more of a permanent result when you have that skincare piece aside with the treatments. We could also do things like Morpheus8 to help control the sebum production in the skin if that seems to be the main issue. There's also treatments like the Morpheus8 with doing a series of a few of those. You can actually control the sebum production in the skin if that seems to be the main cause.
Interesting. Yeah. What is the fastest way to get rid of acne?
So there's no overnight cure for acne, unfortunately. I know we all wish that there was, but I would say the fastest way, honestly, would be a series of those deeper chemical peels, like the medium depth VI peel, because like I said, that is just going to get really deep in there and push a lot of that old stuff out. But then as far as maintenance goes, you do want to make sure that you're on a proper skincare routine customized to your skin in order to keep that from reoccurring.
So we're talking a lot about how to treat active acne. How do you recommend treatment for like post-inflammatory, like scarring on the face? Like what kind of treatments would you recommend for like, maybe I don't have active acne right now, but I have in the past, so I just have that lasting.
Yeah, absolutely. So there's a couple different kinds of what we would like refer to as acne scarring. There's PIE, which stands for post-inflammatory erythema, and those are those red marks that are left behind after your acne has subsided. Those tend to fade with time, or they can turn into PIH, post-inflammatory hyperpigmentation. So both of those can be treated with Flumecca IPL, which is kind of like a laser. It targets variations of pigment in the skin to help brighten those targeted spots. But then when we're talking about pitted scarring, like true acne scarring, that's a little bit more complicated, and depending on your scar pattern, the scar type, like it's boxcar, ice pick, or if it is rolling scars, then you might want to do something a little bit more varied, like a series of chemical peels with microneedling or Morpheus8. Subcision can be a really good factor for those as well. That is where we would take a cannula and, well, not we, I don't perform that service. But you would take a cannula and you would actually break apart the scar tissue underneath the skin to help lift some of those dimples back up.
Is that something like a dermatologist would do?
A dermatologist could do that, or our PA here, Abby, she also offers that as a service.
Shameless plug, Abby. Why can't I pop my pimples if it's okay for the esthetician to pop my pimples?
Good question. So the thing about popping your pimples at home is that you're not in a very controlled environment, and you're also not using a lot of the methods that we would use in office and treatment that will help to loosen up the skin, loosen up the debris so that that plug can extract more easily. When you're also doing your own extractions, we'll say, you're much more likely to go a little haywire and start picking at things that aren't quite ready to come out of the skin, and that is going to cause some scarring. For sure. You're also running the risk of spreading that bacteria around the face, or also damaging the pore. And if you damage the pore, then that is just going to create the perfect environment for future acne to pop up in that same spot.
Don't pop your pimples. Let me pop your pimples, please. Yes. I love it. How do I prevent my acne from scarring?
So there's not really a great way to prevent scarring. You can definitely prevent scarring from being worse than it could be by doing things like keeping your fingers off and not popping your pimples. But the main driver for acne scarring is going to be the inflammation piece. So if you're dealing mostly with non-inflamed acne, you're really not a candidate to develop the scarring the same kind of way unless you are picking at them. Then you can.
Do you think that certain people are predisposed to scar?
Oh, absolutely, absolutely. Medical conditions, genetics, even dietary restrictions can all play a role in the likelihood of you scarring. But the main thing with scarring is to try and keep that inflammation under control. So if you can do things like ice your pimples instead of pop them, that is a great way to help prevent the scarring from being worse than it is.
Is body acne, such as bacne, more stubborn than facial acne?
So I would say that it can seem to be a little bit more stubborn just because the skin cell turnover on the body takes a little more time than the skin cell turnover on the face. So you'll see results generally more quickly on the face than on the body. But no, it tends to respond about as effectively as whatever you're doing to your face.
Would you do the same type of treatments for body acne? Is there something at home that you recommend for people to do just to kind of help keep everything clear back there?
Yeah, so I can imagine that most people don't want to do a full skincare routine on their back. So a lot of my clients who have back acne, I'll instruct them to use a salicylic toner in a spray bottle on their back, especially after showers or workouts. That tends to be really helpful. You can also use a benzoyl peroxide body wash to help control the body acne as well.
One thing I also noticed, personally, because I struggle with body acne, washing your hair first, getting all the product, letting it all rinse out, like your conditioner especially, then washing your body afterwards and making sure your hair is off of your back.
Absolutely.
Because I noticed that I think it was my hair products that was triggering my acne on my back. So I had to change my routine around a little bit, and I realized that it improved a little bit. So
yeah, and that's a great example of why seeing like an acne specialist can be really beneficial, because there are a million examples of little things that you can tweak at home that can help your acne that people don't tend to think about on a regular basis. We are getting some rain.
Pouring. Yeah, I keep looking out the window like, I gotta walk in that in a few minutes.
Oh, I parked way further away than you.
Oh, you're true.
But yeah, so even I know people will cook after they clean their face.
Same.
I believe you actually had mentioned that the other day, that you used to do that and you noticed that your acne was worse than when you washed your face after cooking, just because that oil can vaporize in the air and sit on the skin. So a lot of things like that, your acne expert can actually help you identify and correct any of those little behaviors that might be causing the acne to be prolonged.
So it's really important to be honest with your lifestyle and your behaviors, just that you can pinpoint what exactly might be triggering your acne. Yeah, for sure. Speaking of acne too, in the shower, is there a certain type, this is just from my personal, is there a certain type of what would you wash your body with? What's the most sanitary? Like, I know I threw my loofah out years ago just because I realized how unsanitary a loofah was.
Yes.
Is there something that you recommend, like maybe a clean washcloth every single day, or something that's made out of silicone, or something that's just a little less like antibacterial?
Yeah, so if you're getting mostly non-inflamed acne, like blackheads and the like on your body, doing some like shower mittens, those like scrubby ones.
Oh, yeah.
Those are perfect because you can wash those after every single use. However, if your body acne is a little bit more inflamed, I don't recommend that you use anything that's scrubbing over your inflamed acne, because that is just going to increase the amount of inflammation and prolong the issue. So in that case, you might want to look for a body wash that has salicylic acid in it or some other kind of chemical exfoliant.
Very nice. How can I improve my acne at home aside from skincare?
Yeah, so there's a lot of ways you can do that, like figuring out those little behaviors, those lifestyle behaviors that might be contributing to your acne. Also things like blue light therapy. I love LightStim. They have a wand that you can hold on the face. It beeps every 3 minutes and it works fantastically to help kill acne bacteria without having any sort of like benzoyl peroxide or anything like that sitting on your face if that's something that you tend to be intolerant to. But other than that, skincare really is going to be the main thing that you're going to want to do for your acne.
Very nice. So a personal question too that I have, just because I hear a lot of people say this, especially because it's summertime.
Yes.
People wanting to go outside and expose themselves to the sun to dry their acne up. How do you feel about that?
Oof, that is not something that you want to do. That is absolutely the worst thing you can do for the longevity of your skin. Not only are you risking sun damage like pigmentation and accelerated aging, but the sun damage can actually damage the follicles in your face as well, your pores. And if your pores are damaged, they aren't going to be able to excrete your sebum as effectively as they could, and then you're signing yourself up for future acne. So even though there's that immediate drying effect that can happen with sun exposure that can be really satisfying and can help the acne in the short term, in the long term, you're setting yourself up for a little bit more of a struggle as far as clearing the skin.
Good to know.
Yeah. I would add to that, a lot of my clients seem to be a little bit scared to wear their sunscreen in the summer because they feel like it's going to clog their pores. And to that, I would say all you got to do is find a sunscreen that doesn't have those pore cloggers in it.
That's a big thing too, because for a long time I used sunscreen that clogged my pores.
Yes.
But I was like, what's the worst thing? Like, is it sun exposure worse, or is the acne going to be worse? So like I just dealt with the acne, didn't even realize that there's sunscreens out there that aren't going to clog my pores. So
it's funny you say that because I actually did the opposite thing for my acne. I was so scared to wear my sunscreen for a very long time, and I actually ended up with a lot more damage on my face than I would have if I had just trusted that I could find a sunscreen that wasn't going to cause more breakouts.
So would you say there are certain health conditions that can trigger acne or cause acne?
Absolutely. So PCOS is actually a really big cause of acne. A lot of my clients actually have PCOS. That will cause a lot of excess sebum production because in PCOS you tend to have a much higher androgen hormone, which can also cause a lot of inflammation in the skin as well. So if bacteria is not causing your inflammation, it's usually your hormones, or it could be that you're predisposed to other inflammatory conditions. So maybe even IBS. Gut health is a big one too. A lot of my clients, I like to talk to them about taking prebiotics and probiotics because your gut health has actually been shown in studies to be very interlinked to the state of your skin, especially when it comes to acne.
Interesting.
Yeah. So in-office treatments for body acne, peels are a really, really big one for that. We have the more surface level peel that you can get with Face Reality. They've got their back peel, which I do love. I've had great results with that, but you can also do a deeper peel with the VI peel if you're wanting something a little bit more robust. VI peel does have a body specific peel as well.
Awesome. Yeah. I gotta go get a back peel. Just learned about that. I need that like immediately.
Oh, do you want to do one today? Because I can.
I'm gonna be in the sun. Don't go in the sun.
Yeah.
After you've had a peel.
Yes, absolutely. That is the worst thing you could do.
I gotta stick to my script. I can't tell people to do something and then not do it myself. So
every time I start picking at my face.
Yeah, that's what I was about to say. Let's talk about picking your face because
so
that's something that I do. Don't do it. You shouldn't do it. At least I do it in a controlled, educated manner. It's still not good for me to do it. But
yes. So I think we're both self-admitted pickers here. Absolutely. I struggle with picking my skin very much so. But I've got a few tips. So a lot of my clients, I'll ask them, do you pick at your face when you're in the mirror or do you pick at your face nonchalantly, idly when you're not even thinking about it? A lot of people do both. So if you're the kind of person who is picking your face in the mirror, that tends to happen after you've washed your face and then you're examining your skin. So I personally have those color changing LED light bulbs in my bathroom. And when I go to wash my face, I change them really dim to fun, flattering colors. And then everything on my face kind of
you're not over examining. Yeah,
yes.
For sure.
That has helped me so much with not detail, like zoning in on the details of my face and picking at every little pore. So the other thing too is like if that's not an option for you, just some self-control with staying conversational distance with the mirror. That's also a really big one.
And that's just like staying away from up close to the mirror. Okay.
Yes, because it's really important to remember that no one is looking at your face that close, and there is absolutely no reason for you to be doing that too.
There's some sort of phenomenon. I've seen it online. Have you seen it? It's like where you think that you're the center of attention, but really people don't even notice you. I don't even know. I wish I knew what the phenomenon was called because I literally just saw it. But like, if there was like a study done, like how many people notice
Main
something
character
about you.
syndrome.
Yeah, I'm sure. I'm sure. I think we all have a touch of main character syndrome. But
Oh, yeah,
I mean,
absolutely.
people don't notice as much about you as you think they do.
Yeah. And then another thing to remember too, if you're picking your face up close in the mirror, is think about how your face looks before you're up close in the mirror, and then if you do pick, how does it look after? It is much more obvious, that spot that you were picking at. So if you want people to not be looking and noticing, then the best thing you can do is to not touch.
Keep that inflammation down.
Absolutely.
Yeah, for sure.
Yes.
And then we were also speaking about people who pick just because
Yes.
anxiety maybe, or something related to that, I would assume.
Yeah, so anxiety is a huge driving factor for people who pick skin, both in the mirror and when you're just idle. But I would say the idle picking tends to happen a little bit more often just because there's more time in the day for people to do that. A lot of the times I'll tell my clients, like, if they're noticing themselves reaching up for their face, or if they catch themselves kind of rubbing at their face, then it's so important to just stop yourself right there and start doing something else. Play with your hair, play with your necklace, anything that will eventually hopefully cause that like reach up motion to redirect to away from your face. Pimple patches can be a really helpful thing to do when that is the case too, because when you reach up and touch like your pimple patch, that can sometimes really snap people out of it and be like, oh yeah,
oh, I don't need to touch this. What is this? Why is the sticker here? Yes. To remind you, don't touch your face.
Exactly. Yeah, and they even have those cute ones that are shaped like stars now,
and little smiley faces and stuff. Yeah,
I even saw one that was shaped like Patrick's star. I kind of want it.
I kind of want it too. I didn't know that was a thing.
Yeah.
Also, what do you recommend? Like maybe fidget, like something to fidget with. So just to keep hands busy and not on your face. I've seen like the fidget rings.
Oh, fidget rings are perfect. There's all sorts of fidget toys out there too. I think I've seen even fidget necklaces before. But I mean, if you have like a desk job and you can like keep little things to mess with on your desk, that is really helpful as well.
You know what I thought of? For my birthday, Brittany actually bought me a little, basically it's like this little piece of fake skin, and you fill it and then you squeeze literally like you're popping a pimple. Maybe you should get one of those if you enjoy like popping your pimples like I do, which is very weird apparently, but
I don't think it's weird. I love popping my pimples.
Well, someone else does it because they make a toy for me. Yeah. So somebody else is buying it. I'm sure you're not the only person that's ever bought it. So
no, absolutely.
But yeah, I think that's fun. So if that's something that you just enjoy seeing stuff come out of something.
Yeah.
Get you a little toy.
Absolutely. And listen, if you have something on your face that you really got to get out of it, then just come in for a facial, and you can just always ask us to show you what I got out of it after.
And if you get a hydrofacial, you can see all the gunk in it anyway. I love doing that. I love doing the little swirl, like look at all this gunk that came out of your face.
I didn't mention hydrofacial before when we were talking about treatments, but that's actually one of my favorite treatments for acne too. We were talking a little bit more about peels, but those do tend to require a little bit more downtime, at least with staying out of the sun if you're doing those no peel peels. But with hydrofacial, that is a great way to get that really deep treatment to help bring a lot of that stuff out of the skin without the downtime that you associate with peels.
Very nice. I actually just did a back hydrofacial yesterday.
Yeah.
And then I swirled it around. I said, look at this gunk that came out of your back. That's so satisfying.
Absolutely.
I love it.
If your skincare isn't working, another thing that you could look at are the ingredients that you are using to treat your acne. So we know that inflammatory acne tends to have a bacterial piece behind it. So benzoyl peroxide, like oxygenating products like the Skin Better Oxygen Wash, that can really help kill that bacteria that is lying under the skin. The other thing too is like if your skin's really oily, salicylic acid is perfect for you, because salicylic acid is that oil loving acid that is going to eat away all those little clogs. However, if your skin's a little bit more on the dry side, we don't necessarily want to be using salicylic acid. It seems a little counterintuitive because you want to treat those clogs, you want something to eat away at them, but at the same time, you don't want to over dry your skin. because if you're over drying your skin,
you're going to produce more oil, and
Yep.
then it's going to cause more clogs.
Absolutely. And dehydrated skin does not function properly. And if we don't have functioning skin, if we don't have properly functioning skin, we're going to end up with more acne if we're acne prone.
Very nice. Yeah. A lot of products over the counter right now that people are using on their skin that are pretty viral on TikTok right now, which is not always, TikTok's not your esthetician or your doctor. So
absolutely not.
Please be careful.
Yes.
But a lot of people are applying AHA and BHA to their skin and they don't even really know what it is. So how would you educate the general public about what is an AHA, what is a BHA, what is it doing for my skin, is it good for my acne, and am I layering it with the correct products?
Yes. So their AHAs and BHAs are really your two main categories of exfoliating acids in skincare. BHA really is just going to refer to salicylic acid. That's your beta hydroxy acid. And the difference between your BHA and your AHA is that one is oil loving and one is water loving. So that's why the salicylic acid tends to work better for those oilier skin types, whereas there are a lot of different kinds of AHAs, or what we call alpha hydroxy acids. There can be like ones that are much more gentle and ones that are much more intense. Like glycolic acid tends to be the most intense AHA that you can find, just because it has that smaller molecular size. So it's going to penetrate into the skin deeper than your average AHA does. But as far as which AHA is right for you, that's going to depend on how sensitive your skin tends to be, as well as how dry your skin is. So if you're a little bit more on the dry side and you're struggling with acne, lactic acid can be a great one for you, because lactic acid is also a humectant, meaning that it's going to draw water in.
Lactic acid. One thing I want to ask about that, people who are sensitive to lactose because it's derived from lactose or milk, is it safe for them to use that? Or because it's not absorbed into their system, are they going to have any type of reaction from it? Or typically, is it pretty safe?
I would say it's typically pretty safe. It doesn't always have to be derived from lactose. Our muscles actually produce lactic acid, after working out. That tends to be part of that rebuilding situation. I am not a doctor and I don't know the specifics of that, but lactic acid does not have to be dairy derived. Also, if it is dairy derived, typically the issue with lactose intolerance is going to be your gut breaking it down. And since we aren't putting it in the gut, we're usually okay.
Good to know.
Yeah.
To all my other fellow lactose intolerant girlies out there.
Yes.
That's not fun.
Yes. But yeah, it can be important to know where your acids are coming from. If you have certain food sensitivities, like for instance, I use mandelic acid on most of my acne clients, but mandelic acid is derived from almonds. And so if somebody is allergic to almonds, we might not want to be putting that on their face.
So it's important, again, consult with a professional. Let us know all your allergies, all your different lifestyle, everything factors into your skincare and the well-being of your skin. So
absolutely,
that's why we always recommend, if you can, to consult with a professional before going to Google or TikTok.
Absolutely, yes. There's a lot of conflicting information on the internet, and it's hard to know what is true and what isn't. So finding somebody who has experience treating a wide variety of skin types when it comes to this kind of skin condition can be a make it or break it type of situation when it comes to the results that you get from your skincare.
I agree.
Like, in closing, when it comes to acne, it's a very emotionally charged skin condition, I would say. We both have experience with that. I would say that we both know how much it can affect your life. And I just want to encourage anybody out there who is dealing with acne that it is possible to clear your skin. It is okay that you are dealing with acne. It doesn't make you flawed. It doesn't make you bad. It doesn't make you unlovable or ugly. But it can be painful emotionally and physically to go through. And if you would like some help with dealing with your acne, we are here to offer an empathetic hand, but also our extensive knowledge in our personal struggles, as well as treating a wider variety of skin types with the same condition.
I wanted to also add, we know what we're doing with our skin and we still get breakouts. So don't think that we have perfect skin either, because I actually have a breakout right now. Like
Yeah.
a lot of my acne personally is hormonal. Like it's all driven by my hormones, like
Mhm.
all acne is. But around my cycle, especially, I will get that chin at the very like deep chin acne, and then I pick it, and it's just a mess. So don't do that, please. Don't be like me.
Yes. Yeah, I can attest to that. I definitely still break out all of the time. I actually have made it a point to myself to not hide my acne in front of my clients so that they can know that it is a normal thing to go through. If you're having a lot of breakouts at once, obviously that is something that we probably want to treat because that can lead to scarring and that can lead to a lot of distress. But if you're having like your onesies and your twosies every now and again, totally normal. It just happens because we're human. But thank you all so much for watching. We are honored to be your informational sources when it comes to these kinds of things. And we hope to see you in our office in the future if that is something that you so wish to treat.
Goodbye, everyone. I'm going to go get a back peel now.
Yes. Wait, you were going in the sun.
Never mind.